Welcome to our session on coverage loss and transitions. My name is Aaliyah McKinley, and I'm the Director of Community Outreach and Education at the Asclepius Initiative. The name Asclepius is a bit of a tongue twister, but there were already so many wonderful organizations with the words Kentucky and health in their names. You may not be able to spell, pronounce, or remember it, but at least you'll recognize it if you see it again. Asclepius represents medicine and healing in Greek mythology. The mission at the Asclepius Initiative, or TAI for short, is to provide education and build support for the idea that everyone in the U.S. simply has continuous healthcare coverage from birth until death, so that you don't lose your insurance if you leave your job, get divorced from the policyholder, or move across state lines, events that can happen to any of us at one time or another. In the United States, healthcare coverage can and will be affected by life changes. Coverage can shift or be lost by leaving a job, earning too much or too little for certain types of coverage or cost savings programs, age changes, changes in health status, moving to a different state, getting divorced from or widowed by the policyholder, retiring, etc. For example, after age 26, children can no longer remain on a parent's private insurance plan. Also, workers and businesses that employ less than 20 people must use Medicare as their primary insurance once they turn 65. Due to the way the U.S. healthcare system works, people can also simply lose coverage due to missed notices or paperwork, complicated rules, policy or eligibility changes, or because a plan is no longer available. When coverage is lost, it puts health and financial well-being on the line. Even short gaps in coverage can mean not being able to get necessary medical care, becoming sicker, suffering financial or emotional strain, racking up unaffordable medical bills, or any combination of these. Most people in the United States get medical insurance through their jobs. This can make it harder to change jobs or to work in fields that do not offer coverage, such as independent musicians and artists. It also creates risks. If someone loses their job, becomes too sick to work, or goes through a major life change, their coverage may end. When that happens, access to care can be disrupted. Many of the reasons for coverage loss we just discussed apply to job-based coverage. Someone may also lose their employer-sponsored coverage after reducing their hours, switching to contract work, or losing their job altogether. Other causes of loss of job-based coverage include divorce from or death of the policyholder, employer dropping coverage, turning 65. Remember that Medicare must be the primary coverage for employees of organizations that employ fewer than 20 people, and retirement. For those who resign or are let go from their jobs, COBRA may be available. COBRA allows a person to keep the same employer-sponsored plan for a limited time, typically 18 months, but it can be as much as 36 months in special circumstances. However, the now former employee is responsible for the full cost of the premium. Since the employer is no longer paying any portion of the premium cost to the former employee is usually much higher. COBRA can provide short-term protection, but the price can make it difficult to maintain coverage. Marketplace coverage can be lost if premiums are not paid or if renewal steps are missed. It may become too expensive, especially if income or policy changes reduce discount savings. Premium tax credits, also known as premium subsidies, which decrease the cost of premiums, and cost-sharing reductions, which lower the costs of deductibles, copays, and out-of-pocket maximum limits, are based on estimated yearly income. If income rises or falls, the amount of financial assistance can change. Coverage can also be disrupted if insurers leave the market or discontinue certain plan options. To maintain coverage, people may need to switch plans, doctors, or networks. People with Medicaid may lose coverage when income increases, enrollment processes become overly burdensome, or with changes in federal or state policies that affect eligibility rules, such as work requirements or classes of persons who are allowed to obtain coverage. Some people may remain eligible but lose coverage because of missed forms or deadlines. Even while maintaining coverage, access to care for low income individuals can become compromised by other barriers, such as copays they can't afford. Leaving active military status can change coverage options for service members and their families. Depending on the situation, the service member may be eligible for TRICARE Prime, TRICARE Select, or other TRICARE program or VA benefits. Those not eligible for military related coverage can look to Medicare, Medicaid, the marketplace, or job based insurance depending on their circumstances. Coverage through Medicare is also subject to qualifications. Americans generally become eligible for Medicare at age 65 or sometimes earlier due to disability or kidney failure. Medicare has specific guidelines on when a person can enroll in or make changes to coverage. Failing to sign up on time or missing deadlines can mean no coverage for all or parts of Medicare and or penalties that can last a lifetime. Some people may also lose eligibility for programs that help lower Medicare costs if their income changes or if they fail to complete recertification steps. Having so many different situation specific rules and regulations for coverage, a large number of which are based on factors that can easily change, causes many people to gain and lose coverage or to avoid care out of confusion. This cycling of on and off coverage within short periods of time is a pattern known as churn, and it reduces access to care and impacts health outcomes. There are some life changes that do not cause coverage loss for the insured, but rather necessitate coverage changes, such as adding family members to or removing family members from coverage. Events such as getting married or having or adopting a child trigger a special enrollment period, during which time new people can be added to an insurance policy. In contrast to the addition of policy members, individuals can be removed from coverage during special enrollment periods triggered by the death of a spouse or dependents of the policyholder. Divorce is also a qualifying event, which would allow the ex spouse to be removed from the employee's insurance policy during the special enrollment period. Special enrollment periods generally begin 60 days prior to and last 60 days following the qualifying life event. Most employer sponsored Medicare, Marketplace, TRICARE Prime, and TRICARE Select programs have an annual enrollment period. During open enrollment, you can sign up for initial coverage, change plans when more than one option is offered, or add family members when family coverage is available. The timing of the open enrollment period can vary depending on the type of coverage, employer, or government regulations. Outside of the open enrollment period, the opportunity to sign up for or change coverage is usually limited. However, certain life events can create a special enrollment period. These events may include getting married, having a baby, retiring, or losing job based insurance coverage. A special enrollment period provides a short window to enroll in new coverage or make changes to an existing plan. If the deadline is missed, it may be necessary to wait for months until the next open enrollment period. Also, note that for new hires, employers can require a waiting period of up to 90 days before coverage starts. This slide reviews the open enrollment periods for Medicare, the Marketplace, and TRICARE. During Medicare open enrollment, which runs between October 15th and December 7th each year, you can join, switch, or drop a Medicare Advantage plan. You can change from traditional Medicare to Medicare Advantage or from Medicare Advantage to traditional Medicare. You can also change your Medicare Part D coverage if you have traditional Medicare. Coverage begins on January 1st as long as the plan receives your request before December 7th. The Medicare Advantage open enrollment period takes place between January 1st and March 31st of each year, and contrary to what the name would imply, is for those already enrolled in Medicare Advantage. During this time, you can make the following changes. You can change to another Medicare Advantage plan with or without drug coverage. You can discontinue your Medicare Advantage plan and go back to traditional Medicare. Additionally, you'll be able to sign up for a Part D drug plan. You cannot go from traditional Medicare to Medicare Advantage during Medicare Advantage open enrollment unless you are within the first 3 months of getting Medicare. You can only make one change during Medicare Advantage open enrollment. Coverage begins on the first day of the month after the plan receives your request. There are 2 times people can enroll in Marketplace healthcare coverage. Open enrollment is the annual period when individuals can get, renew, change, or cancel their healthcare coverage. Failure to sign up during this time can result in being uninsured for a full year until the next annual open enrollment period. H.R. 1, also known as the One Big Beautiful Bill Act, which Congress passed in July 2025, has shortened the annual enrollment period by a month. Starting in 2026 for plan year 2027, Marketplace open enrollment officially ends on December 15th. However, states that run their own Marketplace programs are allowed to extend enrollment until December 31st, which Kentucky plans to do. While active military members are automatically covered by TRICARE, they must enroll. For their families and retired service members, there is a specific open enrollment season. During open season, qualified persons can enroll in, change, or disenroll from a TRICARE Prime or Select plan. TRICARE open season runs from the Monday of the second full week in November through the Monday of the second full week in December. Those who have qualifying events, such as marriage or the birth of a child, have 90 days from the time of the event to make changes. Most employer-sponsored plans will also have an annual open enrollment period. However, the timing can vary from one employer to another. Check with your workplace HR department for details specific to your situation. Also note that for new hires, health insurance benefits may not start for up to 3 months. If one type of coverage is lost, alternatives may exist. If you have employer-sponsored coverage, talk to your HR department to see if COBRA is available and what the procedures are to get enrolled, as well as an idea of the projected costs. Information is available online for Kentucky's Marketplace Connect at connect.ky.gov and for the federal marketplace at healthcare.gov. You can learn more about eligibility for Kentucky Medicaid at chfs.ky.gov for Kentucky and medicaid.gov for federal, and for Medicare at shiphelp.org. TAI also has online resources available for free by going to asclepiusinitiative.org and clicking on educational materials for information on Medicaid, Medicare, Marketplace, and military-affiliated programs. Insurance is complicated and expensive, so it can be tempting to just go without. However, there are significant risks to being uninsured. Without insurance, people may delay appointments, fail to follow through with recommended tests or follow-up, not take their medications as directed, or hesitate to seek emergency care. Any of these responses can worsen health outcomes. Without health insurance protections, an accident or medical event such as a heart attack can cause medical debt that takes years to repay or even result in bankruptcy. There are reasons why all high-income countries other than the US provide universal coverage. Not everyone is able to work, find gainful employment, or get a job that offers affordable healthcare coverage. The need for healthcare does not stop when life changes. When coverage is not guaranteed and access to care is not assured, physical health, mental health, and financial well-being suffer. Thank you for coming to our session on employer-sponsored healthcare coverage. Last step, please take our survey, the QR code to the left. It helps show our funder that people are using this material and increases the chance that we will be able to continue to provide useful information on healthcare coverage in the future. The middle QR code will take you to our educational materials on the TAI website. We have a lot of amazing free resources on our website, and I encourage you to check that out. If you are interested in staying up to date with the Asclepius Initiative, there's a lot of great information that we share in our monthly newsletter. Feel free to scan the QR code to the right to sign up for that. We don't do anything with your information other than send you a great newsletter every month. You can follow us on the following social media sites. We're on LinkedIn, Facebook, Instagram, Blue Sky, and YouTube. I want to thank the Kentucky Department for Public Health and their grant that lets us bring this information to you at no charge so that people like you and me can get the resources we need to better understand our healthcare coverage.